Ventricular failure. Here we go. Ventricular failure. Think backwards. Think backwards. Let's start with the left ventricle. So here is our left ventricle. So if the left ventricle fails, the blood is not going to move forward. It's going to move back up, backwards. So we go back to the left atrium. And where did that blood come from? It came from the lungs. So fluid is going to back up in the lungs. We're going to have pulmonary edema, swelling in the lungs, and some symptoms of this are difficulty breathing. Let's go to the right ventricle. Here's your right ventricle. The right ventricle fails. Again, think backwards. The blood is going to back up into the right atrium. And then you got to ask yourself, where did this blood come from? It came from the body. So what's going to happen, if we go back to the body, there's fluid buildup in the body. We see abdominal ascites, swelling in the abdominal area. We see swelling in the legs and also down in the ankles as well and in the feet. And that is typically one of the first symptoms. Remember, symptom is what someone feels and the sign is what they see. So I guess you could say the symptom and a sign is swelling in the lower legs and the feet as a result of that right ventricular failure. Let's look at it with the labels. So again, left ventricle failed. The blood backs up into the left atrium. Where did that blood come from? It came from the lungs. So we're going to see pulmonary edema. The patient's going to experience shortness of breath. Right ventricular failure backs up to the right atrium. Where did that blood come from? It came from the body. And since the fluid is backing up into the body, we see abdominal ascites, swelling in the abdomen, swelling in body tissues throughout systemic edema, swelling in the legs, in the lower legs, and also in the ankles and in the feet. Try without the labels. Left ventricular failure. The blood backs up into the left atrium. Where did that blood come? It came from the lungs. Pulmonary edema, shortness of breath. Right ventricular failure. Where did that blood come from? The right atrium. Where did that come from? The body. We see swelling in the abdomen, abdominal ascites, and swelling in the lower extremities, in the ankles, and in the feet. Thank you for joining me today.